I'm Matthew Gazer, and with my dad, we are One Message, and we make software to make mass government communications very easy. Come on. So I'm Matthew Gazer, and I'm a software developer with the City of Calgary. I'm the #1 ranked innovator on the global innovation website MindSumo, and I studied computer engineering at Queen's.
All right, I'm Phil Gazer. I'm currently the Chief Financial Officer for Beaumont Select. That's a formerly a publicly traded company. We were venture traded. We're now private. Prior to that, I was a sales engineer as well, and I also do Android app development on the side. So Matthew and I have a couple apps on the Google Play website for analyzing financial statements.
I'm not going to get into the problem Innisfail gave us, as I don't think that's the real problem, but here it is just for reference. So the real problem with government communications is, firstly, one, there's a lot to send out. Local governments do a lot of things. Second, there are a lot of people involved in communications, and especially in government where everything needs to be signed off on. So every message often needs to be signed off on by 3 or 4 people. That can get complex in an email chat. And there are just simply a lot of communications channels: Facebook, Twitter, text, phone, and snail mail. It's a hassle to manage all of them. Our elevator pitch is essentially that we are a single interface to manage the authoring, approval, the sending, and the cost management of government messages. The goal is to radically speed up the creation, finalization, and arrival of communications by taking the single created message and automatically packaging it for all these different communications channels. So our value proposition is consistent communications, more rapid and organized approvals, helping you save time with formatting for different channels, making the cost of communications clear and straightforward, as that's often very difficult to do in government when you take a look at all these different channels. And we're also helping transition people away from very expensive mail. So a letter costs $1, say $1.25 with an envelope. A text message costs not even a cent. And also, people like to use different platforms. So One Message makes supporting many different platforms easy. Our business model is just plain software as a service. For communicators, so the people who create, write, and edit the messages, we're going to charge them $20 a month. And approvers who are just signing off on messages are being charged $5 a month. This is not an all-you-can-send service, so the costs of actually sending communications are billed separately through us. Demo time. So essentially, we have a message box here where you can enter your message that you're transcribing. So you can just enter, say, hey, due to the COVID issue, we're proceeding to implement our emergency plan. Please stay home. It will tell you whether that message is suitable for the Facebook character and text message word limits. And if it's not, it will tell you that, oh, hey, this will actually take 2 text messages, so that increases the cost. There's a request approval button on the left, which allows you to enter the email address of someone who you want to approve the message. Right beside it is the show approvals pop-up, which tells you who has approved the message. So in this demo here, we have the mayor has approved the message, but the the communications director hasn't, so you can't send the message out yet because you haven't gotten all your approvals. It has, on the far right, there's a cost breakdown of the message. So this demo assumes that Innisfail has already gone and taken a look at all the various ways that people want to receive communications. So they sent out one last snail mail blast to say, hey, how do you want to receive information from us? And it gets back that information. We load it into a database, and it tells everyone who wants to send the message, say you want to send a message to everyone in Innisfail, here's the actual cost of sending out that message. So here we assume that most people want to receive it by email or text, and that changes the total cost to $38.13 by our fake estimate, instead of the cost of sending a bulk letter, which would be $3,500 for everyone in Innisfail. And once all the approvals are through, once all the costs have been approved, and once all the issues with the message have been resolved, as you can load a style guide into this as well. So many style guides don't allow contractions, and software can detect those. So once all those issues are resolved, there's a big send message button right in the corner, and that button sends the message to the back end and says, okay, prepare it for Facebook, use the Twitter API to chunk it up into the 1, 2, 3 format, record a robocall with it, etc., and has that message sent out to everyone in the Innisfail contact list.
So basically, why you should choose us. We know that COVID-19 is going to devastate a lot of governments. It's going to make budgets very tight for a lot of places. So the idea is if we can eliminate one mailing at 10,000 we're estimating 10,000 just on a population of 30,000 and 3 people per household. So the idea is if we can eliminate that, get it down to $50, $100 just by things like text messages or emails, we can save a lot of money very quickly. It's a very simple project, really, and it makes it a lot easier to get up and running. We're not promising a lot of complex software. We're not promising AI that's going to do some miracles. It's something that we can get up and running very quickly and easy. We have the developers, so we can really start cracking at this right away. And we're not actually trying to fight the government workflow. We're just going to work with it. We're not trying to change the way they do business or their business model. We're just going to try and fit in and simplify and simplify their job.
This is Balaji. I've got a question. Great demo, guys. Good presentation, and I love your background. I guess what I'm struggling to figure out is if you look at the kind of product workflow, which is a way of managing communications to an audience. This does seem to have parallels to some services that exist out there that are primarily used by companies, managing essentially digital marketing messaging to their constituents. What about what you guys have built is specific to government?
I'm personally a government employee, so this was built around many of the frustrations my own communication team has. Mm-hmm. And there are 2 major reasons they don't use things like HubSpot. Firstly, HubSpot marks up the cost of sending messages, and government is unfortunately very allergic to any markup, even if it's for convenience. So in my department, because of the bureaucracy involved in getting new stuff approved, we will spend hours of developer time to prevent spending $30. Mm-hmm. So that's why, can you see the demo yet? We have this cost breakdown here. Yep. And the goal is we're not going to mark up those services, which would make it the same cost as government going out and doing it themselves. And the other key one is in all the requests of approvals. So everything that we do in government has to be approved by the department manager, and then there's the manager above them, and then there's the relevant stakeholders. And it's just an enormous number of approvals that I've personally never seen in any other job. So the focus on that is just to allow those to be organized easily.
All right, perfect. So we have time for one more question. All right, if we don't have any questions, then I wanted to thank both of you once again for coming in to present.
No, I have a question. Sorry, I was on mute.
Okay.
So my question, or I guess where I'd like a comment from you guys is, I think this is interesting, and I can certainly understand the sensitivities for government around multiple levels of approvals and low cost, which are important, and that differentiates government from big companies that might use digital marketing, like one of the other panelists suggested. My concern, though, is especially when it comes to COVID or anything else that's going to be used by government, the whole idea in my mind is that you're able to reach as many people as possible. And with snail mail, there are many people who may not have a permanent residence, who may have vulnerable housing and so on, but there are still ways to get snail mail to people. This creates further disadvantage to people who may not have access to mobile phones, to tablets, and so on.
We're not eliminating snail mail. If you see a physical letter is still one of the options there.
Can I just finish?
Yeah.
So that is my question around, and I understand that you want to eliminate snail mail, but it still doesn't address the people who generally have difficulty accessing information from government. So I'm wondering if there is anything in your innovation that speaks to the group that has the greatest need for this, but is left behind already.
Not specifically, but one of the benefits of this is that you could easily integrate another channel in. So say we set up every homeless shelter with an RRS feed and put a tablet of notifications there, instead of the government having to say, oh, we have to support yet another thing and have to constantly publish to yet another thing. That's one of the reasons my agency, I work for the Parking Authority, we don't support text messages, we don't support live chat, because we don't want to have to deal with all of the processes for supporting yet another interface. So I don't know specifically what the challenges are in communicating with those people, but if there is a way, it is far easier to integrate it with this than to ask the government agency to support yet another account, yet another process, and yet another way of doing things.
thank you for the presentation and thank you for answering the questions. Unfortunately, we've hit time. Just in terms of next steps, we're going to be looking at all 6 presentations, deliberating right afterwards, and we will be putting out the announcement at 3:45. I believe you should have the link for that webinar, but if not, let us know and we're happy to send it over to you. But once again, thank you very much for the presentation, both of you.
Thank you very much.
Thank you.
So no one can deny how alarming the situation we face today is. But guess what? Healthcare workers and caregivers are in for a nightmare. They are torn between their obligations and their rights. Imagine having to work every day in constant contact with patients suffering from the virus, risking not only your life, but also that of your loved ones and family at home. Meanwhile, in hospitals, staff contamination is skyrocketing. Understaffed, hospitals' nurses and doctors find themselves overwhelmed. They work 13-hour-long shifts, exposing themselves longer to the virus, while knowing that the higher the exposure, the higher the fatality. In long-term care homes, where the most vulnerable to the virus reside, the story is no different. We learned that nearly 50% of deaths caused by the COVID-19 are linked to those facilities. Worst, some of them are even being abandoned by their workers. But what do we truly do to protect these heroes who fight for us every day? The promises made to them so far is finding them some more PPE. Well, the question now is it really the right solution? My team and I decided to actually take some action. In only 9 days, we've built the ATR, an avatar telepresence robot that will lower the risk of infection by being easily deployed and remotely controlled by essential service providers using our own developed mobile app. This allows them to safely travel front lines when physical presence is not necessary. With it being remotely monitored, doctors can have permanent virtual presence in ERs and ICUs. Nurses are now able to see patients without having to worry about changing their protective equipment at each entry and exit of a room. We are proud to be the first Canadian-made ATR, and our cost is less than $1,000 per robot. Our unique vision is using recycled high-value components such as electric vehicle batteries and refurbished tablets, of which the estimated inventory is huge. Our pricing strategy is a monthly lease and subscription fee to the mobile app. We have strategic contacts in health and elder care that we've contacted already and who are willing to collaborate with us. My team and I, made up of Louis and Mo, have diverse engineering backgrounds and numerous experiences designing robots. We are passionate workers who actually care and cannot wait to move forward. Thank you guys for your attention, and I'll be more than happy to answer your questions.
How long will it take to make each robot and source the parts and manufacture them and get them ready to go, to be operational?
Sure, great question, thank you. So we are not sourcing anything. Everything is made in Canada. Actually, we've got a great offer from the town of Innisville, who is willing to give us access to the city's building to manufacture our product in Canada. As for the period of time that we need to actually produce and launch our products into the market, we've estimated it to be 1 to 2 months. Including the research and development of the product and getting the right marketing / business guru who would get us the recycled components that we need to produce the ATR.
So is the idea is that this would be used in certain scenarios where there's frequent contact with patients where you'd like to limit that, so like ICU, ER. Can you think of some potential barriers to being able to deploy this more broadly, other than things like infection control and having to do maintenance of the technology? Like, what are some of the clinical barriers would you anticipate to deploying this?
Well, I think that the first clinical barrier we've thought about is the actual size of the robots. We have a design that is very slim and that you can easily move around around the beds of hospitals. We know that ERs and ICUs get very crowded sometimes, and a huge robot like our competitors' ones are very hard to move around. So here are some of our competitors. This is Ava Robotic. It's an American brand who has already deployed their robots in hospitals and also elder care to help with the COVID-19. They have a great robot with very advanced features. The only problem is that it comes with a price tag of $70,000, which is 70,000 times, which is 7,000 times bigger than ours. So our second competitors are T-cards, and those have been deployed in Baycrest. It's a simple design. It's basically an iPad on wheels. And the biggest criticism they got so far is that it still requires physical manipulations to move them around. It's not remotely controlled. So with our remotely controlled ATR, where we stand is at half the features that Ava Robotics have, and at a price that is close, not to say equal, to that of the T-cards.
Okay, perfect. Well, thank you very much. So we've hit time. So just in terms of next steps, we're going to be seeing all of the presentations. We're going to be making our final decision in terms of who is the winner at 3:45 today. You should have the link in your calendar, but if not, let us know. Once
Okay.
again, both of you, thank you very much for participating in the program and presenting to us this afternoon.
Well, thank you very much for your time. Very delighted to be here. Thank you.
All right. So COVID-19 has created a new normal for people around the world. It's a new normal that exists at home, and one group has felt an incredible amount of stress in this new reality: parents and children. Parents' jobs seem to have tripled, making the food, the teaching, the entertaining, and the job that makes money. They've really put on their superhero hats. And kids are stuck with looking for more forms of entertainment with all of their free time. But even before COVID, parents were still concerned about screen time, and rightfully so. The stats tell us that kids with more screen time are more likely to exhibit behavioral problems. But we also know that parents are looking for a way to entertain their children. This is more than half a month's rent in Toronto. When we looked at entertainment, we realized gaming is a staple in the North American household, entertaining all ages. When we looked at screen-free platforms, we realized that voice adoption is on the rise. It's still a relatively untapped market for gaming. So we decided to create an entirely new world through the power of voice.
As an agent, you'll be dedicated to improving the galaxy. We will be sending you to visit strange new worlds that need our help. It's great to have you at the Campfire Agency.
That was a trailer of Campfire Agency, a voice-first role-playing game combining an exciting narrative and storytelling experience with critical thinking and problem-solving. Just picture the imagination elements of Minecraft plus the problem-solving of escape rooms alongside the entertainment factor of a really, really fun RPG. The game will be free to play on voice assistants with optional microtransactions and ads during gameplay. Our goal is to deploy the game onto Google Assistant by the end of this year. This is aimed at improving the lifestyle of Canadian families at home, since Google Assistant is dominating the Canadian market. The following year is all about developing meaningful and high-impact partnerships with successful storytelling platforms such as Wattpad and Scholastic. In 2022, we will enter the US-dominant Amazon Alexa market. We have a diverse team comprised of experts in voice technology and user experience for children, coupled with product managers who can ultimately deliver this creative solution to parents and their children across North America. We believe Campfire Agency can truly have an impact on families by enhancing creativity and promoting critical thinking. We're at the forefront of evolving the at-home experience through the power of imagination and play, and want to become a household name in voice-first gaming. Thank you.
All right, judges, any questions?
What kind of thinking and research have you done on your ability to monetize this?
So we've when we looked at sort of like different revenue models, this is a very typical revenue model that's in gaming right now. So some folks will have a one-time purchase for expansion pack, so we can create the story, because really we're trying to create a universe where we can add in different adventures, different problems, and you can also have consumables. So hints for some of the problems, so that you can move through the game faster or solve the problems faster. And the other staple is ads. Now, ads is something that's relatively new in the voice space, but definitely something that when weaved into the story appropriately, can be a stable revenue generator.
Cool. Any other questions?
Maybe just a question. Maybe just a question on competitive set. So, when you think about, you'd mentioned games and online games that are now available to parents and children. What would you be replacing? Would this be in addition to or instead of? How would you position this in the marketplace with a parent who may want to purchase this?
So I think I can take that one, gentlemen. Hey, so competitiveness, we actually have a slide in the appendix, if you could just jump to that for a moment. But in general, this would be, broadly speaking, competing with other forms of entertainment, which could be broader than just video games. The relationships to be drawn here are between something like YouTube, where kids can spend an awful lot of time, games like Fortnite, which has effectively become ubiquitous in households as a name. But the key differentiator, the key way this creates a space for itself in the market, is through that voice-first interaction model, where it doesn't require a screen. That's something we've found that parents have been looking for a long time, and that's something that doesn't exist at a large scale yet. There are some voice-first games that exist today, but that market, first of all, is not anywhere near saturated. And second of all, most of those games are very light on actual gameplay or on narrative. They focus on things like quizzes, very simple puzzles, such that they can start leveraging the interface in its most basic form, where we're looking to actually find the best way to use the interface, that is, for a narrative experience. So there are some major differentiators between the different types of platforms. From a parental perspective, it would be very much about choosing this for reasons where it doesn't require a screen, where it is an alternative to the kids jumping onto YouTube for 4 hours a day. But it also allows them to understand that these experiences exist in a way that could be beneficial for their children's development, from a creativity standpoint, from a problem-solving standpoint, and eventually through partnership with other narrative or story-generating groups like, for example, Wattpad or Leap. There are opportunities to provide an actual educational aspect in these narratives as well.
Shane, can I ask a question?
Yes, one last question.
Thanks. Have you thought about what other populations or groups this could be useful to? In terms of, your primary market is children, obviously, and their parents, but have you thought about other ways to scale?
So I could take that one as well, actually. The short answer is yes, absolutely. That was actually one of the first areas we investigated with this in trying to establish a target market. We wanted to go with children and families first because A, that's where we're seeing a social pressure right now due to COVID, and B, because that's a low-hanging fruit, so to speak. That gives us an initial market to tap into, to start prototyping with, to create an MVP and establish a brand. But expanding, we'd look more at traditional gaming communities, which involves the young adult to adult market now, where the narratives, the stories could be either more, I guess, intense would be the right word, or have more adult themes. You could effectively compare this in many ways to choose your own adventure novels that we kind of remember from our youth. But advancing upon those, you can have stories that go beyond, I know Shane used the expression like Twilight and Goosebumps, but we can go into the much more deep novel era where contexts are complicated, where the stories are dramatic and have more mature content.
Okay. All right. Perfect. So unfortunately, we've hit time. So thank you to all of you for presenting today. In terms of next steps, we're going to be seeing all of the final presentations, and we're going to be making our decision in terms of who is the winner at 3:45. You should have that link in your calendar, but if not, please let us know. Once again, thank you so much for the presentation and for participating in Hack the Curve.
Thank you.
Well, thank you all for having us.
Thank you so much.
Okay, welcome everyone to our Hack the Curve presentation. Our product is called CoveID. It's a mobile app that's cryptographically proves that you are complying with social distancing. So Social distancing keeps people out of hospitals, but there's some problems. Enforcement of it is complicated. Exchange of paperwork breaks down social distancing. The rules can change as new information comes in. Complicated rules force frontline workers to make subjective decisions, and any attempt at building a central database can be seen as authoritarian overreach. So our solution to these problems is the COVID digital credential wallet. So with this wallet, each person holds their own set of credentials. The credentials can be cryptographically proven to be valid. We're using the open and portable self-sovereign identity standard, and we retain privacy using zero-knowledge proofs. So basically, the system's used to verifiably answer questions like, are you an essential worker? Have you tested negative? That kind of thing. Okay, so what are the benefits of COVID? So it keeps your data private. You hold the data and you control the consent to access to the data. It's a decentralized system, so it's actually faster to build that than it is integrating across multiple government agencies, because the actual integration of the data happens in the wallet that you have yourself. The verifications become a lot easier. They don't require breaking social distancing, and they're handled rapidly using peer-to-peer communications across the internet. So what's the business model and how are we going to sustain ourselves? So we're actually going to give away the wallet for free to the public. And the communication on this is peer-to-peer. So as we scale up, it doesn't actually increase our costs. Where we make money is we're going to charge a monthly fee for organizations to use the enterprise side of the software, basically for issuing and validating credentials. We're going to provide integration, consulting, and training services. And the real value we're going to get out of this is we intend to build a valuable blockchain network cluster that can be used for other SSI opportunities. So proof of insurance, professional credentials, loyalty programs, KYC, AML, passwordless authentication. There's a lot of powerful things you can do with SSI. So our team consists of 3 experienced software startup veterans. I'm Dave. I've worked at 7 different startups. We've got Nilang, who is the CTO for Decentral, where he built a cryptocurrency wallet that scaled to over 1 million users. And Lucas, who's been involved with several healthcare startups with systems supporting the province of BC and international clients as well. So in summary, privately held, cryptographically verifiable data is the most efficient way to manage an evolving set of rules and guidelines for social distancing. So we're at the point where we can actually start building pilot projects for clients. So a system like this has many, many different use cases, and we're able to quickly pivot to the most expedient one so we can build up this network. And that's how we're able to respond very quickly to this COVID-19 challenge. Thanks, and I'm ready to take any questions you have.
Awesome, thank you, Dave. I'll open the floor to our judges.
Hey, it's Alan here. Maybe I'll go first. Maybe you talked a little bit about the applications or your use case. Could you give us a sense of what would be your first use case where you would have the best opportunity to deploy quickly, number one? Number two, it was unclear from your presentation, like what kind of data would you actually hold in this wallet? What would you actually be capturing as it relates to social distancing?
Yeah, so that's actually a good question. I got a little slide here for that. Is what we hold in the wallet are verifiable credentials. So it's cryptographically verified credentials produced by someone. So from a driver's license, you have your home address. From your employer, you have a record that says you're an employee. From the Ontario, there's like the test results you get from your testing, your vaccination records, your medical history. So you get these from different organizations. And on the right hand, these support different claims. So if a police officer asks you, are you near home? So you can actually verify that through the system. If you're trying to skip the line for a grocery store, you can prove you're an essential worker. If you need to visit a senior's residence, can you show that you recently tested negative? When we have vaccines out, have you had a recent vaccination? Through your medical records, are you at risk? So what I like about the COVID-19 response for this is it helps us build a network where we have possibly millions of users. We have government and other organizations involved with this. And so with that, you build a network and you get the network effect for the self-sovereign identity, which means we can build other systems on top of this too.
Anyone else?
Then, is this, I mean, I guess I'm just taking a step up. and looking at it from a higher level, really you guys have built a digital identity wallet, right? So essentially the use case is somebody wants me to prove I'm out and about, and somebody wants me to prove something about myself, who I am and what my rights are and what I can actually do. From that perspective, have you guys sort of thought about other services because that's not a new problem. A lot of people have been pursuing the idea of digital wallets, and obviously those of us who work in digital identity know things that have happened in places like Estonia where they've pursued these kinds of things. Where is the gap in that space that you guys have tackled?
So what we're using is a decentralized model.
Mm-hmm.
So it's not like Estonia or India or let's say some place in the Middle East where they have that, where the government will hold they hold a public key for you.
Sure.
And it's a centralized system like that. Ours is decentralized in that whenever you're doing a connection between two people, like my example here, here's a connection between you and the OPP, you used a decentralized identifier, and that's unique every single time. So, and we're using zero knowledge proofs to pass the information across. So the OPP officer, after your engagement with them, has no record of who you are, your address or anything like that. But what they can do is they can get verified information that, yes, you are an essential worker, or yes, this is your grocery store you're going to, or yes, this is the doctor's appointment that has to happen today.
Okay, all right, perfect. So thank you very much for the presentation. Unfortunately, we have hit time. So in terms of next steps, we're going to be watching all of the presentations, deliberating right afterwards, and then at 3:45, we'll be announcing our winner, and you should have the link in your calendar to join the session, but please let me know if not. But once you thank again for both of you participating in the hackathon and for presenting to us today.
Okay, thanks everyone.
Okay, so I'd like to start off by telling you about one of our co-founders, Roger, on the left-hand side. He's a pharmacist in a small pharmacy in Aurora, Ontario, who's been wearing the same face mask for the last 2 weeks because his procurement officer doesn't meet the minimum requirement by suppliers. On the right-hand side, we've got David, a professor from the University of Toronto who's been recently manufacturing level 3 certified masks but can't navigate the regulatory waters in order to find buyers. So we thought to ourselves, how might we connect these buyers and credible suppliers to ensure that their demands are fulfilled and their needs are met? Well, introducing Infinite Supply. We're an online B2B marketplace that connects buyers and suppliers of personal protective equipment across Canada. A few of our key differentiating features are our visible pricing, our clear certification requirements, our transparent production and delivery time, and what I really want to highlight is our ability to fulfill group purchases. And what this allows is for small buyers like Rogers Pharmacy to bundle their purchases with other small buyers nearby and use economies of scale to realize discounts from their suppliers. But don't just take our word for it. Here's what our customers are saying about our MVP. We've conducted over 10 interviews with some key customers who have validated for us that this is in fact a gap in the market. Through our landing page, we've already facilitated 8 transactions, which equates to 4.1 million units of PPE that is in transit right now to our buyers from our suppliers. There are other competitors in the market, but they aren't positioning themselves quite the way we are. We're very niche right now, focusing purely on PPE in Canada for the time being, and really focusing on our usability in order to win in the B2B market. Our business model is very simple. We have 2 primary revenue streams. One is through our transaction costs, and the other is through a 3% commission fee that we take from our suppliers. We also have secondary revenue streams, such as our automated order fulfillment, which allows us to realize recurring revenues each month. Based on this business model, we project that we will see profits by year 3. And by year 4, we will have captured 1% of the $3.3 billion Canadian PPE market that's right now growing at a 6% CAGR. But what does this mean past COVID-19? Well, right now we're in phase 1. We are focusing purely on the Canadian PPE market. From there, in 2021, we are going to start scaling into other Canadian industries and other supply chains. By 2023, we are going to use this business model that is very easily repeatable and create local marketplaces in other countries to really get to scaling. Our team has the passion and skills to execute with a variety of expertise and 4 key mentors. Our purpose is to protect our frontline workers and support local Canadian suppliers while global supply chains are breaking down. We've already have 4.1 million units of PPE in transit, and it is just the start. Thank you.
All right, perfect. I'll open the floor to any judges.
If the lack of supply is the challenge, which is what seems to be the case in a lot of situations, I guess I'm wondering, what have you guys specifically done to address the lack of supply? Like, how does that work? I feel like that's part of your sort of value prop, but I'm not really sure how. Like, other people that have tried to say we need more supply and haven't been able to do it, what are you guys doing differently?
So what's really interesting about that is the underlying assumption right now in the market is that it's just simply a matter of lack of supply.
Mm-hmm.
And through our research, we're actually finding that that isn't necessarily the case. So one of our suppliers that we actually just brought on yesterday, he used to manufacture sporting equipment in Canada, and he's recently transferred over his manufacturing plant to start developing and manufacturing PPE here in Canada. But all of his distribution channels and all of his networks have always been in the sports market. So he doesn't know how to navigate this new industry that he's found himself in, which is the PPE market. And so that's just one example. We also have other examples of suppliers that maybe are completely out of stock of gloves, but we have a supplier who has a lot of stock of robes. And we were able to connect him to someone in Alberta who was specifically looking for robes. So it's less of an issue of there isn't supply out there. The issue is really the visibility between who has supply and what level grade is the supply and who needs it. So that's the issue that we've identified, the pain point we've identified through our interviews and through being in this industry, is that it's really an issue of visibility more than just simply an issue of lack of supply.
I understand.
I have a question. So thanks for the presentation. I thought it was very clear. Quick question for you. Beyond the current pandemic, which I think you've clearly identified, and you're quite right in the fact that it's not only a supply issue, there's a connection issue. You mentioned that you want to scale into other industries long term. How would this company not run into the same problem as other small companies that have, like the manufacturer you talked about, that has to develop a whole new set of contacts and channels from sports into medical technology? How would you as a company move beyond medical and PPE into these other industries that you mentioned?
Yeah, absolutely. It's a great question. So our first plan of action when scaling past medical PPE is to actually scale into other industries of PPE. So my background's in civil engineering. So every time I heard the word PPE up until recently, I just thought of hard hats and steel-toed boots. So there is more that we can do within the PPE industry to grow. So we're going to start in that direction just because we feel like a lot of similar distribution channels will be able to use. And it's really just about building the capabilities. So building the capabilities to understand what certification requirements we will need once we enter into a new industry, what distribution channels we'll need to develop. So it will be a little bit of a hiccup at each one we try and get on, but we're building some of those core capabilities that are repeatable depending on each industry we go to. So we're really focusing on tightening up those core capabilities to build off those. Does that answer your question, Linda? Great.
Perfect. So we have time for one last question if any of our judges have one more.
Yeah, I have a question. So how do you validate the suppliers into this network is sort of the first part of the question. And then the second part is, are you central to the payment of that the buyer would have? Are they paying you and then you're paying back to the original supplier? And if you can just clarify how that works. So how do you validate them, and then from that they're actually giving what they say they're going to give? And then are you central to the payment?
For sure. I'll just tackle that second part of the question about the payment, and I'm going to pass on the first part of your question to my peer. So with regards to the payment, we are facilitating the transaction directly between the buyer and supplier on our platform, and we take a commission fee from the supplier off of that, as well as a transaction fee. We also have a premium package available for our suppliers that are conducting more than 40 transactions a month, so they can pay a flat rate of $39.99 a month, and then they don't have to pay that 99-cent transaction fee. But so it's all facilitated through our platform directly from the buyer to the supplier, and we take that 3% commission fee from the supplier. And I'll just actually hand it off to my peer, Akila, who can touch on the regulatory issues that you mentioned with regards to the suppliers.
So for the suppliers, to validate them, we have many different buyers on our platform, or eventually will. That includes people that don't need high certifications. So what we're doing is we're providing the ability for people to put their certifications on our platform. So they have the CE certification, the FDA. If they're 3M certified, they'll have the OEM certification. So therefore, a buyer can be informed of the certification of that product and buy the product to their needs. Like if a mall was buying it for all their security staff, they wouldn't need hospital grade level 3 protection for their PPE. So it just depends on who's buying it as a buyer, and they can choose what kind of protection they need through the availability of information.
Okay, perfect. So unfortunately, we've hit time. So thank you for participating in the program and for joining us today for the presentation. Just in terms of next steps, we're going to be announcing the winner later on this afternoon at 3:45. You should have that information in your calendar, but if not, please let us know. But once again, thank you so much for the presentation today.
Thank you so much, judges. Have a great day. Cheers. Bye-bye. Thank you.
COVID-19 has created a ripple effect of problems. When restaurants shut down, food distributors were throwing away tons of food. So farmers lost contracts and revenue, and grocery stores became overwhelmed. They were unsafe for our frontline workers and our seniors. That's why we created Feeding Our Heroes, an online platform that connects local suppliers with customers and city halls to provide fresh food boxes designed to flatten the curve and support our frontline workers and our seniors. We knew speed was our biggest factor to success, and we're so excited to say we are actually live. In the last 48 hours, we've had over 21 orders, $1,700 in total sales, and 36 care packages are ready to be donated. Our Feed the Heroes platform allows you to purchase these boxes online that are COVID-19 compliant with no contact delivery and curbside pickup. Our most exciting part is our accessibility innovation, where people who are visually impaired, elderly, even people who are blind can go on our website and purchase boxes on every single device and on every single browser. It's a simple, proven business model. Buy one, give one. When you buy a box, you give a box to somebody in need. So let's quickly talk about why the box is so innovative. Well, there's less contamination by reducing the touch points on the supply chain. We're able to give consistent branding as well as food safety, eco-friendly, and a proven business model with subscription and trial boxes becoming more and more common. Our care package are distributed through a partner program, which are hospitals as well as senior citizen associations. And our farm and market entrepreneurs isn't just about produce. Think about people who create jams. Think about bakers. This audience is very not tech savvy, so we provide a hands-on white glove approach to our technology. Our municipal city halls are one of the most important pieces of these distribution networks. And why is it so important? It's a place people can trust. It's central location, accessible, and guess what? There's one in every single town. So this could be scaled out quite quickly. Our competitive landscape allows us to be extremely competitive when comparing us to grocery stores, online subscriptions, and food delivery services. And our business model is simple. The more boxes we sell, the more donations that we give out. Our scalability comes in a few factors: our farmers, our city halls, and our ability and experience with blockchain technology. We've actually successfully tracked food from farm to table on the blockchain, and we want to bring this technology to this project as well, especially being so important with COVID-19. Our team is the perfect recipe for success. And this is why we think we should win. You could put a pause on the economy. You could put a pause on loans and mortgages, but you cannot put a pause on people needing food. And we think we are solving the number one longest problem that's going to affect us for COVID-19, getting our seniors food. We also have result-driven technology that's live, working, and proven to work. We're inclusive in making sure everyone gets down that line. And we know with DMZ's help, we can scale this out to more people and create impact today. Thank you so much. And we are open to questions.
Perfect. Judges, the floor is yours.
Sorry, I'm not really clear on how the business works downstream. Like, I understand the farmer's market and fresh produce and getting into boxes. And then I guess it all goes to a center point at municipal city halls. And then what happens?
Yeah, absolutely. So there's kind of two-prong approach. The way that we've done it live right now is we have a website. And if you go on our website, you can purchase these boxes. And these boxes are compared one-to-one that we give out. And so our boxes are coming from local suppliers or local farmers. So if a farmer wants to create their own box, let's say Fresh Farms creates the Fresh Farms box, they'll include what they have on their farm. So it might be some prepared foods like apple pies, maybe some jams, and maybe some local produce that they have. They create this box for a certain amount where we know the cost of it, let's say, is $20. We know our care package is $10. So we're essentially going to be at least $30 plus the fees that happen for the just kind of a service fee. And so in that sense, what they do is we give them the technology outlet to promote their box that they want to sell. If this farm, let's say, is in Innisfil, and this is someone who we're speaking to, an Innisfil farm, and we've spoken to farms there, they put their thing on on our website, they get to fulfill the order, and they provide that they can go to Innisfil Farm to pick up their box there. That makes sense. So we provide the technology solution. So eventually this could be scaled out to somebody in British Columbia. Come on our website. Are you from British Columbia? You'll see the farmer market boxes that are available in British Columbia. People can purchase it, and then those farmer markets fulfill those orders.
So it's like a DoorDash except for farmers markets kind of thing?
Yeah, so the difference, I'll tell you the key differentiators of it. Okay, so the big difference, first of all, are their boxes. And what makes it innovative with boxes is the ability, first of all, food prices right now are changing by the day. One day chicken's available, one day apples are available. It's quite outrageous. These boxes allow you to make it a simple business model. It's a $20 box. If it's gonna be 5 strawberries today or 8 bananas tomorrow, this is the box that we have to fill with that. And then there's obviously the one-for-one social component to it as well. The other big factor is that right now, if you go to grocery stores like Walmart or Loblaws, I don't know if you've tried, but it's almost impossible to find a time to actually pick up groceries and actually get them delivered. This is consistent. So what we have with our program is every Tuesday and every Friday, we consistently are fulfilling orders for people. So we know that on a weekly basis, people can get their orders. And then if you want to really compare us to Skip the Dishes, they don't have fresh food. That's a big piece of it. So they don't have that fresh component. They don't give back in a sense directly to consumer dollar. And truthfully, the COVID-19 thing with Skip the Dishes isn't as effective as this. We reduce all the pieces of the supply chain. Boxes come right from the farmer's market or right from the supplier to the person's house. So you don't have you don't have all these ingredients from different places that people touching along the way.
Just once again, can you tell us how far along are you with respect to your supplier relationships? Like, I know you have it already because you're already in market, but
yeah.
How did you do that, and how big is that space for you?
Oh, the network is getting quite big. We have our local suppliers. We're reaching out to farmers markets. The local farmers right now, it's going to hit in about 2 weeks. That's when actually a lot of farmer production is going to be coming across. We've talked to farms in Innisfil. We've talked to a lot of farms in Markham. They're all looking for new avenues. To understand the demographic of these farmers, they're not tech savvy. They work in the farm, or they're people who work in the kitchen. They need technology. They need that white glove solution. And so with our platform, we're allowing them, so we can help upload it for them right now. We can help them price it out, and we can help them really take all this extra food that's sitting there. Like, it absolutely crushes our hearts to know that there's people who are hungry and food banks that are overwhelmed, and there's tons of food getting thrown out. Like, where is that connection, and why is that being made? Local farmers aren't getting the money that they need, and these suppliers are throwing out food because of it. And so it's this crazy ripple effect. And so if we can find a way to directly connect local farmers to consumers, but make it easy for them to do, that's helpful. I've helped personal restaurants try and get on Uber Eats, and it's not simple. It's not an easy task. It takes quite a long time. And ideally, you just want to call someone up and say, please help me put this up. And a lot of these suppliers, they're not able to do it because they have so many different product lines. This is simple. Get a box, the $50 box, the $20 box, the $30 box. It's an easy economics. We give one-to-one, and we exponentially grow those donations. And so we live for 48 hours. We're giving already 40 boxes away. And we know, honestly, with a little bit of help from DMZ and the support network that's there and the communications and marketing, we could really impact a lot of people today and make a difference today.
Sorry, can I ask a quick question, Shane? How, like, logistically, how are the boxes delivered? Do you still depend on the same distribution channels as, you know, traditional, or how do you have your own workforce to get boxes out? How does that work?
Yeah, so I think there's only one person who's asked for delivery so far. Most have been curbside pickup. Again, because it's City Hall, I think a lot of people generally want to get out of their house, but want a really safe way to do it. For a delivery system, it is us right now delivering. We do have a volunteer network that has also been able to do it. There's also the courier aspect to it. If it is our local farmers, we're going to rely on our local farmers to do that curbside pickup at their local farm, and to just try and avoid people touching. That's the big goal here is how do you get less people touching everything? And so even with our shipment that's coming in on Tuesday, it's literally going to come to the City Hall, get dropped off at the front, and those delivery orders are going to be put in people's cars right from there. So it's not even going to enter the building, some of the stuff. How do we get less contact is important.
Okay, all right, perfect. So on that note, we've hit time. So thank you very much to you and to the rest of the team for participating in the hackathon and for presenting to us today. Just in terms of next steps, we're now going to be deliberating, having seen all the pitches, and we're going to be announcing our winner at 3:45. The link and information for that should be in your calendar, but please let us know if it's not. Once again, thank you so much for presenting.
Thank you so much. We're very excited.